Today, I will be talking about the effects of TDCS on a psychological disorder of my choice. I've decided to look at its effects on obsessive compulsive personality disorder. To save time throughout the presentation, I will be referring to this disorder as OCPD. I will be discussing a brief history of some major discoveries that paved the way for modern TDCS and how it came to be what it is today. The first evidence of transcranial stimulation in history comes in Roman Empire times, when Scribonius Largus described how placing a live torpedo fish over the scalp could relieve a headache in a patient. In 1660, the German scientist Otto von Guericke invented the first electrostatic generator. This device could be considered the first stimulated device, and its variations were used later to stimulate muscles in sheep and frogs. Edina's work was the milestone which began the era of DC stimulation for neurological and psychiatric conditions. In recent years, TDCS has been used for conditions such as depression, anxiety, and schizophrenia. I will be briefly discussing the physical mechanisms of OCPD in order to better understand the effects TDCS has on it. People with OCD are typically distressed by the nature of their behaviors or thoughts, however much they are unable to control them, while people with OCPD fully believe that their actions have an aim and a purpose. Some basic characteristics include a need for perfection and control, a preoccupation with details and order, devotion to work, hoarding tendencies, and a rigid and inflexible regard for morals, ethics, and values. There is considerable evidence that OCPD has a biological component. MRI scans have found OCPD patients have significantly less white matter in their brains than normal. The brain region commonly associated with OCPD is the basal ganglia, which is located underneath the cortex. When looking at PET scans, it was discovered that individuals with OCPD have an overactive caudate nucleus in the basal ganglia and orbital cortex in the frontal lobe, meaning that the orbital cortex sends too many messages to the caudate nucleus. I will be briefly discussing the physiological effects of TDCS. Its full name is transcranial direct current stimulation and is a neuromodulatory technique that delivers low-intensity direct current to cortical areas, facilitating and inhibiting spontaneous neuronal activity. Its primary mechanism of action is a polarity-dependent subthreshold shift of resting membrane potentials. Beyond these regional effects, TDCS has been shown recently to alter cortical as well as cortico-subcortical functional network connectivity. In addition to TDCS, is now being used to probe the brain on the assumption that it can modulate specific networks depending upon the electrode montage. Although much remains unknown, there is a growing evidence that TDCS offers a promising approach for exploring brain-behavior relationships across a variety of cognitive, affective, sensory, perceptual, and motor domains. To date, TDCS has been extensively used in human cognitive neuroscience to understand brain function and brain plasticity in the treatment of a variety of psychiatric and neurological disorders. Low-frequency rTMS applied over supplementary motor area or orbitofrontal cortex has been shown to be the most effective in reducing OCPD symptoms, yet the evidence is insufficient to recommend a specific protocol in the treatment of OCPD. The three main assumptions for improvement through TDCS are patients will demonstrate significant symptom reduction following TDCS, patients will demonstrate significant reductions in anxiety and depressive symptoms, and patients will obtain higher scores on tests of executive control and working memory. Following TDCS, several studies showed that TDCS could induce specific changes in neuropsychological, psychophysiological, and motor activity as a function of targeted brain areas. However, the application of TDCS has shown inconsistent results, which can probably be attributed to a lack of randomized controlled trials with adequate sample size. Electric field stimulation can guide further clinical trials in psychiatry using personalized TDCS montages with distinct electrode positioning according to clusters of symptoms. TDCS is a promising tool for basic neurosciences, clinical neurologists, and psychiatrists to facilitate the treatment of various neuropsychiatric disorders and enhance neurological functions in healthy humans. Although TDCS has demonstrated benefits, the scientific community must communicate carefully about their findings. Some concerns that need to be considered in further research include the optimal approaches in further research, the ethics behind the tolerable amount of risk, and whether TDS should be used on healthy patients. These are just a few concerns that should be addressed. I have my references still listed below. Thank you for listening to my presentation.